IBR, infectious bovine rhinotracheitis. It's caused by the bovine alpha herpes virus. It's a febrile disease in cattle with the general symptoms of respiratory problems, abortion, conjunctiva, and encephalitis. So an overview of the herpes virus family. It consists of three families: the alpha herpesvirus, the beta herpesvirus, and the gamma herpesvirus. It's double-stranded DNA, it's enveloped, which means it has weak resistance. Most are stenoxin, but some are uroxin, such as Ojeski's disease, and they have a strong CPE and they have a long life. So the occurrence of infectious bovine rhinotracheitis, it's worldwide. It's more frequent in large-scale farms due to more animals. But due to eradication programs in the European Union, they are less frequent nowadays. The etiology of the disease. So the alpha herpes virus has a subdivision called the varicella genus. And this genus has such viruses such as the bovine herpes virus 1, which causes infectious bovine rhinotracheitis and abortion, and bovine herpes virus 5, which is a more recent disease and has neurosymptoms such as encephalitis. So the epidemiology of the disease. The susceptible hosts are bovine and other ruminants. It has a moderate morbidity, around 20 to 50%, and has a low mortality, under 5%. And it's shed through discharges, mostly respiratory, conjunctiva, and in bull semen. The virus in the bull semen plays a role in genital form. There is a latency in nervous tissue which can cause reactivation, and animals can be lifelong carriers and have intermittent periods of shedding. This is why the disease can be endemic in farms. The pathogenesis of the disease. The first one is the respiratory form. Encephalitis and abortion are most often associated with this form of the disease. The virus enters the body through an aerogenic infection, and the primary replication happens in the respiratory endoepithelium. This causes viremia in the lymphoid cells, and then a secondary replication occurs in the lungs, the brain, and the fetus. In the lungs, it causes bovine respiratory disease complex. In the brain, it causes encephalitis in calves, and in the fetus, it goes through the placenta and causes abortion, depending on the stage of pregnancy. The second form of the disease is the genital form of the disease. It's IPV, which is infectious pustular vulvovaginitis, which doesn't result in abortion. And there's also IPB, which is infectious pustular balanopothesis. There is a venereal infection in the semen, and the primary replication is in the genital mucosa. This causes a viremia in the lymphoid cells, and then the secondary replication happens in the genital mucosa. And the clinical signs are inflammation and edema. In the clinical signs, we can see high fever, lethargy, and anorexia. In the respiratory part of the disease, we can see respiratory symptoms such as serous nasal discharge, conjunctivitis, a red nose when they're under 6 months old, and the disease in adults is subclinical. It only affects calves from the ages of 1 to 6 months old, but in adults it can cause a drop in milk production, which can cause an economic loss. Infectious bovine rhinotracheitis can also cause encephalitis in calves. It's rare, but it can affect calves under 5 months old, and it travels along the nerves due to the latent. The disease can also cause abortion, which is sporadic in heifers, and the fetus has no characteristic lesions, but it can result in autolysis, and in early infection, it can result in embryo reabsorption, and after 70 to 90 days, it causes abortion. For the clinical signs of the genital aspect of the disease, in infectious pustular vulvovaginitis, we can see mucopurulent discharge, edema, but there's no abortion. There's pustules and coalescence, and there's spontaneous healing from days 10 to 14. In infectious pustulobalanopoethys, the prepuce has edema and it's inflamed. There's decreased libido, and there's a painful erection and ejaculation. In the pathology, we can see interstitial pneumonia, and it results in bovine respiratory disease complex. It affects the upper respiratory tract is inflamed, there's edema and hemorrhages. We can see non-purulent encephalitis in the histopathology. And in the abortion, we can see multifocal necrotic foci, especially in the skin, liver, and heart. For the diagnosis, we can do virus isolation, as there's a strong CPE from the nasal discharge. We can detect the agent from IF and immunohistochemistry from the tissues, and with a PCR from the discharges. We can detect antibodies in the milk, and using ELISA and virus neutralization. For the treatment, there's no specific treatment. You can do supportive and symptomatic therapy. For prevention, the vaccination needs to be done to prevent the clinical signs but not the infection. It must be repeated due to the weak antigen every 6 months. In a pregnant cow, you give the vaccine 6 and 3 weeks before they give birth, and in a calf you give the vaccine when they're 4 to 6 months of age. The vaccines have a live, attenuated, inactivated virus. And to prevent the virus, you can have closed herds, semen-negative bulls, and to quarantine and do serological tests on new imports. For the epidemiology rules, isolate all the individuals of the same age group and have cleaning and disinfectant. To control the virus, you need to do eradication by number 1, herd replacement. It's simple, easy, but expensive. Number 2 is have a generation free of the virus. Vaccinate the herd. Raise calves isolated from the herd. So at birth, isolate them, give them colostrum, and then at day 3, do a serological test. And number 3, selection. Test all the cows in the herd. Less than 10% of the animals in the herd should be seropositive, and then you should cull the seropositive cows. If over 10% of the animals are seropositive, then vaccinate all cows with a test and discriminate with the ELISA test. It's important to monitor the imports, and the marker of the vaccine is you repeat it every 6 months, and this decreases the shedding and clinical signs.